Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Now this is the second question we are going to do now in part B, episode number 5. We already done the first question. So this is the second question. Immunoglobulins. You have 2 minutes. So the pointer timer is there at the right hand side bottom, and then you can prepare, you can learn, you can study, you can analyze in these 2 minutes and be ready with the answer. Your time starts now. Yes. So the time is up. Now we are going to see the answer. Check your answer, whether you are right or not. So the text says, in the event of supply shortage, treatment plans for long-term patients should be modified. So both the parts of them are mentioned. Both parts of the question are mentioned. Okay. Now the text specifically states that approval is required, B, from the relevant on-call service in case of clinical option. That's not. And option C says, although the text states that immunoglobulins carry out an inherent low risk of blood-borne infection transmission, and the two specific conditions, hepatitis A and parvovirus B19, are generally not found. So, and then it says patient should be informed about the need for prior consent, not about the risks of blood-borne infections. So that's how it goes. Right. Now, let's analyze the question. Yeah. So here, what does the memo say about immunoglobulin treatment? So that let us analyze. What does the memo say? Okay. What does the memo say? Okay. What does the memo say about immunoglobulin treatment? So immunoglobulin treatment. So recall that one. Okay. Immunoglobulin treatment. So it is talking about treatment. So what does the memo say about immunoglobulin treatment? That's you have to notice. Okay. That you have to notice. Now let us see here. Now if you see the question, the keywords, STEM question, you see the keyword memo. Memo is there normally. The next one, immunoglobulin treatment. Then what does it say? Okay. Now, if you see, now treatment is more important. The word treatment is more important. So let us analyze that based on that one, treatment. So we bothered about treatment. Now, if you go, the most important word is say. So what does the memo say? Inform, suggest, tell. So the question is testing for stated information in the memo. What is informed? What is told? What is stated? What is the memo telling, informing, or suggesting you to do? That's point it is. So now if you go to the question options, three options. We have three options. Now, what are the operating words in the three branches? So A, B, and C. First one is lack of availability could lead to patient's therapy being revised. Lack of availability could lead to patient's therapy being revised. So therapy. Okay. So therapy. A lack of availability. So availability is not there. Okay, availability is not there. A lack of availability. What availability? Yeah, immunoglobulin treatment could lead to patient's therapy being revised. So treatment should be revised. Therapy should be revised. Okay. Permission may be given for administration in urgent situations. Permission may be given after admission in urgent situations. So this is talking about urgent situations. What type of situations? What type of situations? Urgent or ordinary? In urgent situations, permission is given. Ordinary situations, permission is not given. So it depends on situations. First one is therapy. Lack of availability could lead to patients' therapy being revised. So it is regarding therapy or treatment. So lack of availability, something is not there. So availability is not there. Okay. Something is not there here. Okay. No problem. Okay. So permission may be given after admission in urgent situations. So situations are important. If it is urgent, permission will be given to go ahead with immunoglobulin treatment. Otherwise, permission will not be given. That too after admission only in emergency situations. So next, third one, patient should be advised that contracting a serious illness is unlikely. So contracting a serious illness is unlikely. So contracting a serious illness. So this is about illness. So you will not get ill. Okay, it's not possible. You will not contract a disease. That's what he's telling. So first one is lack of availability. Availability is not there. The second one is situations, urgent situations or ordinary situations. Availability, yes or no. Lack means no. Patient should be advised that contracting a serious illness is unlikely. So you have to inform the patients that so they will not get this disease. That's the point. They will not get this disease. Now let us see these 3 points. Let us see these 3 points. So urgent situations only. Illness unlikely. Okay, fine. Right. Next, if you go to the statement, once again, the stem wants the memo statement. Okay. The stem wants the memo statement. For example, let us take A. A matches with in the event of supply shortage. In the event of supply shortage, see here it is. In the event of a supply shortage. Shortage means lack of. Shortage means lack of. Yeah. Shortage means lack of. Availability means supply. A lack of availability. So that's it. A lack of. Okay. Lack means a shortage. A lack of availability means a supply shortage. Okay. Supply shortage. Right. So next, could lead to patient's therapy being revised. Now here, revised. Revised. Revised means changed, modified. Modified. Okay. Could, should. Okay, lead to patience. 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 Okay. Lead to result. Okay. Lead to being revised. Okay. So in the event of a supply shortage, treatment plans. So treatment means therapy. Treatment plans. Treatment means therapy. Okay. So for long-term patients should be modified. For long-term patients means patients, the type of patients. Then to and for. That is the relation. Okay, be, being. Now you can notice here that all the points are related. Okay, could means should. To means for. Patients, long-term patients. Being. So be. Revised means modified. Therapy means treatment plans or a treatment. Lead means result. Okay. Lead to means result. In the event of, in this case, this will lead to this one. So lead to, in the event lead to, you can connect this one. So if this is the condition, this will happen. So lead to. So in the event, in this case, this will happen. This will lead to. So now you can see very carefully. Okay. This is how every word to word will be related. If you can identify, then it will be very easy for you. You have to understand the relationship between words, text words and option words. So lack of means shortage. Availability means supply. Could means should. Patience, long-term patience. Being, be. Revised. Revised means altered, modified, transformed, changed, adjusted. So all these synonyms, you have to remember all these synonyms. Okay. So then you will get the answer. Other things. So administration in urgent situations. Permission may be given after admission in administration in urgent situations. So try to understand that one. Is it talking there? Okay. Permission after administration contradicts the memo's approval is required before treatment. Okay. Approval is required before treatment. See there. Approval is required before treatment. Patient should be informed that prior consent to treatment is required. First of all, consent to treatment is required. Remember that. Urgent situation. So this is contradicting. Okay. This is contradicting. Permission may be given after administration in urgent situation. No. Whatever it is. So patient should be informed that prior consent. Okay. Prior consent to treatment is required. So what does that mean? Approval is required. Consent is required. Approval means consent is required. You can see here. So you can see here also. Approval is required from the relevant on-call service. Okay. Emergency. See, here it is. In the case of clinical emergency, that requires immunoglobulin for a class 2 indication to be given out of hours. Approval is required. No. So, may be given. No, may not be given. Approval is required. Okay. May be given means chances are there 50-50 like. So, no. Approval is must from the relevant on-call service. So, that is contradicting the statement. May be given and approval is required. It's okay. Without approval, you will not give. So, approval is must. So, without approval, you cannot give. So, that's the point. It's contradicting. Next one, C. Now, here, C suggests advising patients. Okay. C suggests advising patients about illness risk. Memo only says patient should be informed. Okay. Not about the risk likelihood. Patient should be informed. That's all. Not about the risk likelihood. Nobody is telling about risk likelihood. Any patient whose treatment is cancelled or delayed by a duration of 2 weeks or more must be recorded in the incident reporting system. So, all these things are there. So, see that one, C. So, patient should be advised. No, it should be only informed. That's all. Told. Only information should be given. Okay. Information should be given before consent. Not about risk likelihood. Right. So that's it. So because of this, you can understand that the answer is a lack of availability. Lack of availability. B is wrong. So why is B wrong? Memo says approval is required from the on-call service before use in emergencies. Okay. Not may be given in emergencies. Okay. Permission may be given after admission. No, before, not after. Okay. So, B says, memo says, approval is required from the on-call service before use in emergencies, not afterwards. But in B, it is telling after. In B, it is telling it is after. Okay, now let us use red to rule out. Here, B is telling after administration. But here telling is before. Okay. In the case of clinical emergency that requires immunoglobulin for class 2 indication to be given out of hours, approval is required. Approval is required before only. Okay. Prior. So prior means before. Prior consent means approval. Okay. So is prior consent to treatment is not after, right? Before. So be careful. That is ruled out. B is ruled out. The next one, C. Memo mentions low risk, but does not direct staff to reassure patients that contracting illness is unlikely. So risk is there. Low risk is there. You see, low risk is there. low risk. Low risk. So, patient should be advised that contracting a serial illness is unlikely. Unlikely. How can you say not possible? Low risk is there. Low risk. You cannot say unlikely. Risk is there. Chances are there. For some people, chances are there. Sometimes chances are there. So, low risk is there. Not very high risk. Low risk is there. But risk is there. Na? So, you cannot say serious illness is unlikely. You cannot say like that. That is how it goes. So, next. Yeah. So, this is how you are supposed to analyze the question. Right. Now, go through the points here. So the text says, in the event of supply shortage, treatment plans for long-term patients should be modified. So both parts of the question are there mentioned. Okay. Option B, the text specifically states that approval is required from the relevant on-call service in case of clinical emergency. Option C, so that is ruled out. Approval is required before, not after. Next, option C, although the text states that immunoglobulins carry an inherent low risk of blood-borne infection transmission. Low risk is there. And that two specific conditions are there. Hepatitis A and parvovirus B19 are generally not found. It says that patients should be informed about the need for prior consent, but not about the risks of blood-borne infections. You need not tell them all about the risks. You need not tell anything at all because low risk is there. You cannot say no risk. How can you say unlikely, not possible, impossible? Possible. Low risk is possible. So that's how you have to go. So, my dear friends, you can subscribe, like, share, and comment. Subscribe and hit the bell icon so that you will get the links as soon as I share the video. Then you can like the video so that we can gain more visibility. Share the video with your friends generously and give a comment, write a comment. Your support our work. This goes a little goes a long way. So share generously and provide your valuable feedback in the comment section below. For registration, if you like the sessions, for personal sessions, you can contact me on +91 98778 67360 for personalized training. Thank you for watching this video. See you in the next video.